Thanks a bunch for showing interest in learning about how we determine in our office how healthy low back and hips are. All of our tests measure range of motion, which is the biggest indication of function. So we're going to show you what tests to do and how to score them. None of these will provide a full diagnosis, since it's just saying how much your function is, but not telling you what's causing the restriction. That's what exams are for. But let's get into some of these tests right now. This first test is called a straight leg raise test. What we're doing is evaluating the health of the back of your hip, your hamstring, and the sciatic nerve that has to go between those muscles. Full range of motion is going to be a 90-degree angle with no tension or symptoms whatsoever. We're going to do our measuring today using this app. It is an iHandy level that you can download in the Android and iPhone marketplaces. So now we're going to show you how to do the test. You're going to need a friend at home and what it means. So what we're going to do is you should be able to get this leg, or whatever leg you're testing, straight in the air at 90 degrees without the other leg moving at all, with no symptoms whatsoever. So to do that, I'm going to take our level and put it on May's shin. And I want to lift this foot up as much as I can while the back of the knee is still on the table or surface or whatever you're on. And then I'm going to zero it out. So there's a button on here that's going to make this a new neutral, even if it's not totally level. So she's got a couple degrees of knee extension here, and we're going to take that out of the equation. Now that we're here, my hand is behind, just above her ankle, and I'm locking her knee straight. I'm going to slowly raise her leg up as high as we can, stopping at 90 degrees. So as I get here, I'm looking for that other leg not to move here. May, how's this feeling? We get to right now.
There's a stretch in my hamstrings down to my calf.
Okay, so that's almost 90 degrees. So that's about 89%. So 89 divided by 90 is practically 100%. So that is an A. Since May doesn't have any significant issues with her sciatic nerve, hamstring, or anything like that, any symptoms she's having are likely not coming from there. I would then do the same thing on the other side, looking for the left leg to stay on down. Other things to look for would be the toe turning out. If the toe starts turning out, what's happening is you're borrowing range of motion from the hip as opposed to actually getting hamstring range of motion. So you have to look for the body to compensate sometimes. But this is the test. 100% A+ is the leg straight in the air, and you'll know it using this app. Now the next test we're going to go over is evaluating the hip capsule and the adductor, which can cause pinching, deep hip pain, and contribute to back pain. So this test is called supine hip flexion, and we're measuring the function in the hip joint. The goal for this is bringing the thigh to the rib cage, straight there, with no symptoms, no deviations, and it should touch with ease. Scoring for this is as follows. Every inch lost is a loss of 10% function. So every inch between that thigh and the rib cage is a loss of 10%. For the quick and dirty measurements, what we do is we use a finger width measurement, and we say that's about 3/4 of an inch, and go with that. So if you're missing 4 fingers, that's 30% function. Now, how to do the test. So as I said, we are trying to bring the thigh up to the rib cage with ease. Some common things you might see would be the other hip starting to come off the table, which is indicative of your rest of your hip and your spine borrowing range of motion. So that's something to look for. So as you raise that thigh up, make sure the other one stays on the table. And also, the thigh has to go straight to the rib cage. If it deviates out, so if we have to go almost like a frog leg with your foot out here, that's cheating. That's indicative of some extra bone growth in your hip and that's something you should go over with your doctor. But here we go. We're going to go bring this thigh to a rib cage, going straight there. So my hand is behind her knee, and I'm going to have you put your finger on your rib cage. So that's where I'm shooting for. And I'm trying to go all the way here. As you can see, the thigh comes off the table. So I'm going to go right about here. This is about full range for her. She's about 4 finger widths, which is about loss of 30% function. This is to be expected because she actually does have some hip symptoms from time to time. So that's how you do the test. Bring the thigh to the rib cage. It can be more difficult to do by yourself, but if you can manage to keep your thigh on the ground and you grab behind your thigh to pull this up, you're good to go. So there it is. So let's move on to our next tests. This next test is called kneeling hip extension. And what we're trying to do here is see how far your hip can extend. So to do that, you're going to get in this single leg kneeling position. May's torso and chest are going to be above her hips. So one thing you shouldn't do is lunge forward like this. Lunging forward where your chest is way over your knees, this doesn't count. So you're going to go back. What she's going to do is lead with that other knee, keeping your chest upright and sinking as low as you can. This range of motion should be a full 12 inches from the knee that's planted to the bone in the front of her hip. So put your finger on that bone at the front of your hip. That bone, that little bony guy that's the prominence right next to the belt line is where we do this measurement. So what we do here is we'll take our ruler and we'll put it right here, right where her knee is at. So 1 inch is down there, 12 inches this way. I'm going to use my level as a plumb line. This is the bone at the front of her hip. I'm going to put this right here. You can move your hand for me, May. I'm going to make sure this is nice and level. And I'm going to see exactly how far this goes. So May here is at 9 inches and 12 inches is full. So 9 divided by 12, 0.75. That's a C level of function in her hip extension. It should have an additional 3 inches. So if she had some lingering back pain or something of that nature, this could potentially be something that could be treated and fixed and contribute to less back pain and fewer symptoms. We do this on both sides, making sure that that bone at the front of the hip goes a full 12 inches in front of the knee, keeping the chest upright. If you see that somebody is really straining or their back is super arched, that's also another sign of you're going further than what the test should allow. So this is how we're going to evaluate lower back health and overall health, the whole posterior chain. So from the back of your hips all the way up to your lower back. You're going to cross your hands like you're about to dive into a pool. You are going to keep your feet shoulder width apart and knees locked, and you're going to slowly go down and try to touch the ground. You need to be seeing exactly where symptoms are and how far it is and how much difficulty you have doing that. So as you can see, May can go all the way to the ground. How'd that feel?
There's a stretch in my hamstrings and my lower back.
All right, so May does have some mild lower back things going on, and that lower back tension is indicative of that dysfunction. So she can touch all the way, so this is why she really doesn't have much in the way of symptoms. Full range of motion is getting those fingers to easily touch the ground. 50% range motion is getting your hands to your knees, and 75 is about mid-shin. That is what you're looking for. If she has significant symptoms in her back or down even all the way to her calves or feet when doing this, this is telling us that there is possibly a sciatic or disc problem that's being challenged as she bends over. Because when doing this with full health, there should be maybe some mild tension in the hamstrings and really nothing else. So what we're going to do now is we're going to test for hamstring strength, which is super common in athletes and can lead to a lot of lingering back pain, even if everything else is healthy. So do a lunge. What you have to do is step forward, striking with your heel, dropping your knee down, chest upright, and then returning to that point. So your toes come off, your heels come off. Your heel is the first thing to touch the ground and the last thing to leave. There should be no heel dragging. The toe shouldn't be pushing off. It should always be the heel. When your heel is planted, that means that everything is very fluid and you don't look like you're going to fall over. That means your hamstrings have sufficient strength to keep you balanced and to provide this range of motion. Signs of a failed lunge would be using your hands to push off your thighs to help out, a toe drag, a heel drag. Any of those would indicate that you have less than optimal strength in the hamstrings.